the main goal of pulmonary thromboembolism treatment is to decrease your symptoms, to open those clots, and so the main goal of the treatment is not to make the clots bigger than those are at present. So these can be achieved most of the times with medicines. So mostly the medicines which we use are the anticoagulants. That means they prevent the blood from clotting again. So those are the primary medicines that we use. If you have more symptoms, that means submassive or massive embolism, which means your BP is very low, less than 90, or it is less than 40 mmHg from the previous normal BP range, or if your heart rate is very high and you are old age and chronic lung disease or chronic heart disease, in those cases we may require to give you thrombolytics in addition to the anticoagulants. So what does a thrombolytic does is, so it breaks the clot that is formed. So the anticoagulant, it prevents a formation of a new clot, whereas the thrombolytic breaks the clot that is already formed. So, but it has some inherent risk, this thrombolytics, like increased predisposition to bleeding from other organs like brain or abdomen or anywhere in the body. So that's why we assess the risk benefit ratio. If there is more benefit for the thrombolytics compared to the risk, then only we will advise this thrombolytic. So in patients with more severe condition, more severe pulmonary embolism, who have more bleeding risk, with thrombolysis from peripheral veins, that is veins in the lower legs or forearms, then we may give this thrombolytic directly at the level of pulmonary arteries. This can be done by an interventional radiologist. So the interventional radiologist role is to break a clot if it is a severe pulmonary embolism and the patient is not a candidate for systemic, that is IV thrombolysis from a peripheral vein. Then we go up to the pulmonary arteries, we inject the thrombolytic there, or without using thrombolytic we may suction the clot, or we may break with the clot with our special devices, so that your block in the pulmonary arteries will decrease and the circulation to the lungs will be restored again. So we do this with the help of local anesthesia. There is no need of general anesthesia. So with local anesthesia, under ultrasound and our X-ray guidance, we put a small needle in your lower limb vein, and through that needle we put a small catheter, that's a long narrow pipe, and this pipe we will take it through to your lung arteries under X-ray guidance, and there once we reach the level of block, we may inject the thrombolytic, or with the help of catheter we will suck out the thrombus, or with our special catheters we can break the clot, and thereby we can restore the circulation back to normal in the lungs. So this is the role of an interventional radiologist in the treatment of pulmonary thromboembolism. So other treatment which is offered is surgical embolectomy. Means if the patient's symptoms are severe and there is no available treatment from interventional radiologist, means the interventional radiologist is not available and good surgical team is available, then you may go for open surgery. They can cut open your chest and open your pulmonary artery, and then they can remove the clot and then suture the artery and the chest wall again. So this is the other treatment that is available.